Abby, the floor is yours. Oh, also, I'm sorry, we're also offering CEU credits for this course. We're offering for nursing, medical, pharmacy, and then a certificate of attendance for any other professional. All right, sorry, Eve, the floor is yours.
Okay, thanks, Amanda. Yeah, so as Amanda said, my name is Abby White. I'm a pharmacist. I have worked for Indian Health Services for almost 17 years in September, and I've worked in several different capacities as an IHS pharmacist, as a chief pharmacist, as a clinical pharmacist, and most recently as an informaticist for the last 7 years. So we're going to go through kind of how the RPMS pharmacy package interacts with what providers or prescribers see in EHR, and then do our best to answer any questions that you guys might have at the end. So the goals of our presentation today are to discuss the pharmacy package and how it relates to EHR, discuss how the RPMS drug file affects prescribing in EHR, demonstrate how to enter and sign a prescription in EHR, including the function of e-prescribing, and then provide some examples of some commonly used or potentially helpful pharmacy reports. So we're going to start real basic and just kind of lay some groundwork for everyone listening today. So the pharmacy package has several different components to it. The first one that we'll talk about briefly is the outpatient pharmacy package. And in its most basic sense, this is what the pharmacist uses to process or to finish outpatient prescriptions. There's several different commonly used functions in here that are part of outpatient prescription processing, including updating patient allergies or adverse drug events. We can also use this area to designate whether a patient receives or needs to use non-safety caps. And if you use a pharmacy that has mail order options, we can also designate mail order status for a patient. Point of sale billing is part of the outpatient pharmacy package. There are some tools or some features where you can create different queues or lists to help you when you're organizing how you want to process prescriptions. And then there's a lot of different reporting options available in the outpatient pharmacy package as well. There's a few additional features and tools that just kind of depend on how your site is set up. CMOP is centralized mail order pharmacy, so there are functionalities or some features that we can edit in the CMOP menu. The ACR, the telephone refill transaction menu, if you are a site that's set up to use audio care for refill transactions, you might be using that. There's also the add edit providers if you are a site that accepts outside prescriptions. So as in a prescription that's written by a physician or a provider not within your clinic, you might be utilizing the tools in there. And then also the return to stock. And I will kind of say each of these topics that we're talking about today, this is just a very high overview of them. We could probably go into an hour-long discussion on any of these individual topics. So if there's questions that you have, take note of those, or we can definitely address those at the end. The next little bit of the pharmacy package we're going to look at is the inpatient pharmacy package. So in its most basic sense, the inpatient pharmacy package is used to process inpatient medication orders. It can also be used to process outpatient intravenous medication orders. So this is also where barcode medication administration tools kind of live in this area of RPMS. This is where we print intravenous labels, and then there's some specific reporting related to IV labels and inpatient medications that we can access from the inpatient pharmacy package. A couple other handy features within here are inpatient order entry. So if perhaps you're a pharmacist and you receive a verbal or a telephone order from a provider, you might enter it through inpatient order entry. The inpatient profile option allows you to look at any admitted patient's medication profile. There's some options for printing labels and reprinting labels. And then the non-verified and pending orders, that's how we access orders that have been placed by a provider that need to be finished and processed by a pharmacist. So those are sort of two pieces of the pharmacy package. This last piece that we're going to talk about is the drug file. So the drug file is part of RPMS. It's a database of all the medications that are available within your system. So your drug file contains an entry for every single medication that is either in your pharmacy or your providers need to be able to prescribe. And the way a medication is entered into the drug file controls, controls what setting that medication can be prescribed in. So is this an inpatient medication, an outpatient medication, or possibly both? The drug file also controls a ton of other features. So the way the medication displays, synonyms for how pharmacists are looking up that medication in the pharmacy package, and also synonyms that the provider might be looking for through EHR. This controls what routes are available for a particular medication, what dosages are available, dosage forms. This is also where we update the NDC, the package size, the dispense units and cost, which relate back to point of sale. There's also functions in here where you can limit the maximum available dose as sort of a patient safety feature. Within the drug file, a couple other sort of specific tools that get used very frequently are the standard schedule management option. That's where we can control on the inpatient setting. If we wanted to say QAM is at 7 a.m., that's where that information gets controlled. We could change that to 8 a.m. or 9 a.m. Just depends on what the ward does. The orderable item management is a function that we get into often. The orderable item is what the provider sees when they're prescribing a medication through EHR. And then again, the synonyms, which is really, really valuable to have your synonyms up to date so that both pharmacists and providers can access medications quickly. So we're going to start to put all these pieces together, but we've got one more thing to look at, which is the medications tab. So the medications tab in EHR is really, this is your patient's medication history. There are a lot of different tools on here where the end user, the individual person who's logged into EHR can control their view. So there's some filters where you could view only active prescriptions or only chronic prescriptions. You can adjust the look back. There's a calendar option. Most sites have a default on that of 365 days, but you can change that to go to almost 10,000 days worth of medication history. You can use this tab in EHR to print a medication list or to print a paper prescription if you needed to print and sign something. This is also where you go to write or to order, place medication orders. You can check drug-drug interactions through this tab. There's also links that are available within this tab in EHR to access patient education or prescribing information. And then you can also use this to document outside medications such as OTCs or herbal medications. So this is just a screenshot of the medications tab. This section that I've outlined in red, these are a lot of those control features. So this active only button, if it was pressed, it would only display active medications. This chronic only button, if you pressed it, it would only display medications that were listed as chronic. This is your calendar button where you can default the number of days worth of medication history that you display. I will give you a warning, if you make that date range really, really long, like into the thousands of days, it does take the system typically a lot longer to pull that information up. So you may have a lag in your display when you extend that calendar date range out really far. There's a couple different print options here. This new button is where providers would click on to open up the ordering menus to start prescribing medications. These last three buttons, I don't think are used very often. We kind of forget about them in the pharmacy, but they can be helpful tools. So this check is a check for drug-drug interactions. So you could highlight any combination of rows from the medication list and click check, and it will do a drug interaction check. It doesn't give you a ton of detail, but it will flag you for really, it'll flag you that there's drug interactions, but it doesn't necessarily tell you the detail of that interaction. As a pharmacist, I might check this just for a real quick overview. And if anything comes up, I might check that med list again inside of LexiComp or another drug interaction checker. The ed button, if you have a medication selected and click that, it should bring up a link to LexiComp or some other drug database where you can print off a patient education sheet. And then the I button will bring up prescribing information. So how do the drug file and the EHR medications tab interact? Kind of our key points that we're going to go over here are how a medication gets built into the drug file determines how and where a medication displays inside of EHR for prescribing. And then well-functioning quick orders and organized quick order menus can encourage more accurate prescribing based off of your formulary and treatment guidelines. So we'll kind of take a look at those things now. So this slide right now is showing us on the left-hand side, we have a few different screenshots of medications in the drug file. And when you bring up a medication in the drug file, you can immediately see where that medication is marked to be used. So either as an inpatient or an outpatient medication. So in this first example, the medication that I selected, it's listed as outpatient. So it's really only listed as outpatient. So this means that that medication is marked in the outpatient pharmacy package, and the prescriber can only write that as an outpatient medication. Whereas the next example down here, this medication that's marked as a non-VA medication, that indicates that the prescriber or anyone in the system could document that medication as an herbal medication, an OTC, or within the section for medications prescribed by external providers. And then in this third example, we have a medication that's listed as a unit dose or a ward stock item. And those are synonymous with being inpatient medications. So things that are only listed for unit dose or ward stock, those can only be prescribed as an inpatient medication. So this next slide I'm going to show you, hopefully will make that a little more clear because we've kind of got it lined up with our medications tab. So on that first example where it was marked as an outpatient medication, that means if the prescriber is clicked in this top section of our medications tab, they can prescribe that as an outpatient medication. Any of your drugs could be marked as a non-VA medication, like in that second example that was in green. So your middle section of EHR, oftentimes it'll say non-VA medications. Ours says non-CIHA. It's just the name of Cherokee's hospital system. So anything documented in this non-CIHA section here indicates to me that the patient is getting this medication, but we are not providing it and we are not prescribing it. So it might come from an outside physician, it might be an OTC, it might be an herbal. That's what things in this non-CIHA. So anything marked as a non-VA means that you'll be able to document in this section. And then the third section of your medications tab, looking at inpatient medications, if you have a drug like in our third example from the previous slide that was marked as a unit dose or a ward stock item, those can be used to document in your inpatient medication section on the bottom. So when we look at quick orders and quick order menus, you use those tools inside of EHR to organize your medications. to kind of visually make them easier to find and easier to access for your prescribers. So this is a screenshot of just our outpatient medication menu. And you kind of notice that it is organized into kind of large, body systems, and within that sort of disease states, commonly accessed problems or diseases. So quick orders, there's a lot of different ways that you can organize your quick order menus or your quick orders. It is best, it's recommended that you kind of work with providers about sort of what their preferred options are. A couple things that we have found to be helpful at Cherokee has been to incorporate some clinical decision support into the quick order menus and into the quick orders themselves. Some things that have also been helpful are incorporating lab orders along with medications when it's appropriate. Weight-based dosing menus for pediatrics have been very helpful for our facility. Also considering utilizing a single menu to incorporate lab, medication, and imaging for prenatal care has really saved us a lot of, it's really kind of streamlined prenatal care. You can sort of take that method of combining lab, medication, and imaging to create menus specific to really any number of disease states. One of our more recent projects has been to utilize the antibiogram information to encourage antimicrobial stewardship through prescribing. So on this slide, I've got a few different screenshots of some examples of what that looks like in our system. So this first one is a screenshot of our antimicrobial handbook menu. And so you'll kind of see on here, we've got each of our kind of disease states. When you click inside of these, you're presented with the treatment recommendations, usually first, second, and third line if it's available, and then some clinical decision support. So just notes about when you would or would not use this particular medication or any restrictions there might be on that. This section here is showing our hypothyroidism menu. So we've got, this is an example where we're grouping some labs onto the same menu with medications, along with some prescribing considerations. And then our last little option that we have here, this is an example of parental dosing that we had been having a lot of medication errors, prescribing errors with dosages. And so we kind of came up with this little menu that builds in some clinical decision support and provides a lot of defaults so that providers don't have to kind of look all over the place for information related to parental dosing. So when it comes to prescribing inside of EHR, prescriptions should be entered using the medications tab or the orders tab. They should not be documented really anywhere except for, let me take that back. They should be documented in the medications tab if you're a prescriber, if you only document a medication change in the body of your note and don't subsequently put in a new prescription, that does tend to cause confusion for pharmacy. Or if you're starting a new medication for a patient, you might make note of that in your plan in the body of your note. But if you don't also put in a medication order, pharmacy is not going to know that they need to be looking for that order. That's not going to show up in the queue. Providers should primarily be entering prescriptions into EHR, but you might have local policies at your facility that permit a non-provider, like a nurse assistant or an RN or a pharmacist even, to enter an order on behalf of the provider, either as a telephone or a verbal order. And then prescriptions have to be signed by the provider before they'll show up in the queue or the list of pending prescriptions for pharmacy to process. Sometimes that hangs us up. We might have, for example, like a prescription renewal request that's been sent. It's been entered in the system. It's waiting for the provider to sign that. Until that provider signs it, pharmacy is stuck. Pharmacy's hands are tied. We can't finish that prescription until it gets a signature from the prescribing provider. So this slide just sort of details the steps to entering a prescription into EHR in case anybody needed that kind of baseline information. So at its most basic form, you need to select your patient and select a visit. For providers, you should make sure that you are listed as the provider for the encounter, aka the doc in the box, and I'll show you a screenshot of that on the next slide. For non-providers, you want to make sure that the provider who is you're anticipating to sign this prescription or sign this order is listed as the doc in the box. So typically you'd be navigating to the medications tab, clicking on new, and then utilizing your system's quick order menus to navigate to the medication that you need. You review and sign that order, and then we're all set. So here's our screenshot with the patient being selected. In our system, the visit encounter information is in yellow. I think it's either yellow or green in most sites. But the person's name who's displaying in this yellow box is the doc in the box. So that's where if you're the person prescribing, you want your name to be there. If you're prescribing or if you're entering the order on behalf of a prescriber, you want to make sure that that physician or that nurse practitioner or PA is the person whose name is displaying in that yellow box. So we're navigating to the medications tab. We can find the new button, and then we're going to utilize our quick order menus to get to where we need to be for what we want to prescribe. And then this is the quick order itself. So sometimes folks in pharmacy they're typically not going into EHR to order medication. So they don't always know what this medication sort of dialogue screen looks like. Whereas physicians are always going into here. And sometimes I know pharmacy gets questions and they'll say, well, I don't see this dose on the quick order, or I can't find this quick order. And so there is at times a little bit of a disconnect between the two. So on this quick order, I tried to break down where different information comes from on any quick order. So this top section, this section that's outlined in yellow, this information is coming from the drug file. So the way this leflunomide drug file entry was created is controlling the dosages that are available. It's controlling the routes, and it's controlling if we've defaulted a schedule. This is not recommended use in pregnancy. This is also part of that individual drug's drug file entry. The quick order setup is defaulting the dose and the route and the schedule. In this red section, this is all part of the quick order. So when your informaticist creates a new quick order, these are all prompts that they get and they can default for you. So if at your site, you might do 90-day supplies, they can change your quick order so that it's a 90-day fill, 90 tablets, and 3 refills. This section at the bottom, the blue section, this is the final prescription as the pharmacy will see it. So as a prescriber, if you make changes to the quick order, so say you select a quick order and maybe you want to change that to be 40 milligrams instead of 20 milligrams, as you make changes up here, you will start to see those changes be reflected in this section that's outlined in blue. After you've got the prescription entered to your liking, as a provider, you would accept that order and then sign it using your electronic signature code. For non-providers, depending on your policy, you would accept the order and then either indicate that it was a verbal, a telephone, or a policy order. So we're also going to take a quick look at entering a prescription using the e-prescribing function. So if you have a patient that you're e-prescribing for, these two options, the outside pharmacy ERX and the outside pharmacy print, is what you would be utilizing. For a quick little definition for these other pickup options, clinic indicates that the medication was given in clinic or administered in clinic. The mail function indicates that the patient receives mail order prescription refills. Window indicates that they're picking that up in your in-house pharmacy. So the outside pharmacy ERX, This allows the provider to send the prescription to an outside pharmacy electronically, and that includes potentially controlled substances if that provider is set up for two-factor authentication of their prescriptions. The outside pharmacy print function allows the provider to print a hard copy of the prescription that can then be physically signed, printed and signed, and then the patient can take that to an outside pharmacy. So with e-prescribing, this is a method to electronically send a prescription to an outside pharmacy. A few key points to keep in mind, and you might need to incorporate your informaticist into this conversation if it's not already set up for your providers, is that individual medications need to be marked in the drug file to allow for e-prescribing. Providers need to have a SureScripts provider ID number assigned in their provider file to enable e-prescribing functionality. That number, that SureScripts provider ID or SPI, can be requested by your informaticist. At some places it's a site manager, it just kind of depends. And then providers can, in addition to being able to set up for e-prescribing, they also need to be set up with two-factor authentication in order to prescribe controlled substances electronically. So if you were going to be e-prescribing a prescription, this is what you would be seeing in EHR. You would select the outside pharmacy ERX option. If that patient had already had prescriptions e-prescribed to an outside pharmacy, say a Walmart or a Walgreens, that pharmacy's information would display in this pharmacy section. If they've never had anything e-prescribed in the past, then if you click on the drop down, you have the option to go to other, and then you'll get this search box where you can search for a pharmacy. I have found that the easiest way to search for pharmacies is really based off of zip code. So I'll use the zip code function, enter in the zip code, and then kind of change the radius to search maybe 5 or 10 miles from that zip code and hit refresh. The pharmacies that meet your search criteria, they will display at the top of the list. So all of the options will still be available, but the ones that meet your criteria will just get floated to the top. Regarding controlled substances and e-prescribing, so this is a method to digitally sign a controlled substance prescription using two-factor authentication. A digital signature is not the same thing as an electronic signature. So in EHR, we use an electronic signature code to sign a note or to sign a lab order or a non-controlled substance prescription. A digital signature is used specifically for controlled substances. And the DEA has, there's requirements for using a two-factor authentication. It either has to be something you know, something you are, something you have. So you have to have two of those three options to consider for the DEA to have considered you're using, I'm going to use air quotes, two-factor authentication. So for us, we use something we know, which is our electronic signature code, plus something we have, which is a two-factor USB token. It might also be at federal sites, your PIV card. So this allows providers to send controlled substance prescriptions electronically to outside pharmacies. It allows providers to write up to 3 C2 prescriptions using do not fill functions. And then it also allows a pharmacy to accept an electronic controlled substance prescription, which internally for your internal pharmacy, it eliminates that need for paper and a wet signature. So we're going to jump into some reporting options. There are a lot of different reports, and the ones that I selected are ones that I know we use every day in our pharmacy at Cherokee. So this first one is the Controlled Substance Management Report. We run this on a daily basis to reconcile controlled substance prescriptions with our C2 safe transactions. On the side here, I've got highlighted just the steps, the way that we process or the way that we run this report. if you wanted to try it on your own system. We also use the DUER, the Drug Utilization Evaluation Report. This is a really quick method to look for prescription data based off of a medication. So for example, if you wanted to find out who did we fill Buspar for in the last 3 months, or maybe the last 2 weeks, or whatever date range you want to access. And again, there's a screenshot with the step-by-step on how you can run that for yourself. Some other reporting tools we use, it's called the AMIS report, which is used to determine daily prescription volume. That's really used by our chief pharmacist. VGen, Visit General Retrieval, is a tool that is not specific to the pharmacy package, but it can be useful to search for prescription information. We use a variety of different Omnicell and C2 safe reports to reconcile controlled substance discrepancies. We can also use specifically the C2 safe reports to search for controlled substances that are about to expire, so we can reorder before they are expired. Script Pro reports, if you have a Script Pro at your site, there's a bunch of different reports that you can pull from there to access daily workload, breaking things down by pharmacist and by hour. And then another, I guess the last tool is iCare. So iCare is a population management database that really mirrors RPMS, but it allows the user to develop lists of patients who meet whatever search criteria you enter into it. So you can use this to search for medications. You can use this for really any number of things. But what's really nice is that your informaticist could create an iCare panel for you and then share that information with you for you to access. An example that I know we've used often in iCare is to generate a list of patients or a panel of patients who've been prescribed Vivitrol for a specific time frame. I know we've used that for some grant reporting. And then what's also is kind of nice, and this is a whole long training session in and of itself with iCare, but you can access the patient's entire chart from iCare. So if you're doing some chart reviews, iCare can be really a little bit faster for certain chart review functions than EHR is. So in summary, the pharmacy packages and EHR are really directly tied together. So prescriptions are entered into EHR. They're processed and verified by pharmacists using RPMS. The medications that a provider sees inside of EHR are directly controlled by how that drug has been entered into the drug file. Quick order menus, quick orders themselves can help your site organize and standardize your prescription order entry, cut down on errors. E-prescribing and two-factor authentication are features that can be turned on individually for providers. And then many prescription and reporting options are available in RPMS and iCare. Just kind of depends on what you're after. So I know that is a ton of information, and a lot of it is pretty high level, but I'd be happy to answer whatever questions, or if anybody wants to have an offline conversation, if we kind of go down a rabbit trail, I'd be glad to talk to you about anything.